Well, the doctor is in, and our topic today is diagnostic imaging. When your doctor orders a CAT scan or an X-ray or something similar, you may wonder, why do you need it, if it is really necessary? Well, Dr. Scott Ackerman, one of the First Coast's leading doctors, is here with us today to discuss the pros and the cons of diagnostic tools. Thank you so much for being here. You know,
Thanks, Casey.
Something that you don't think about, and then you get in the situation where you might need one, and then you're like, I have no idea what you're talking about. Like, why do I even need this? So first of all, before we even talk about the difference between CAT scans or whatnot, let's talk about the benefits of diagnostic studies.
Okay, so a lot of times patients see their physician and a X-ray or a diagnostic imaging study is ordered. And they may question, why do I need to do it? Is it dangerous? What knowledge is going to be gained from it? We use imaging as an integral part of patient care. It allows us to see inside the body without opening someone up. Before we had imaging, we would suspect a mass or suspect a tumor, and we would take the patient to the operating room, and the surgeon would open up the patient, look inside. But now we have all sorts of amazing ways to look inside the body with X-rays, with CAT scans, with MRI scans. We have mammograms to look at, to evaluate the breasts. We have ultrasounds. In fact, virtually every American has had an ultrasound. But when they were in their mother's womb, they probably had an ultrasound done. So a lot of women, we do ultrasounds to look at babies. So all these things are amazing ways to look inside the body. And each of these different tests is different, and they each provide a unique view inside the body.
So I had said CAT scan at the top. That's not technically right, because they don't even call it a CAT scan anymore, do they?
Right, we used to call it a CAT scan, but now we just call it a CT scan.
Okay.
A CAT scan is when we only could look through the body in one axis, but now we could splice and dice these pictures anyway, and so we call it a CT scan, or computed tomography scan. And this is how it works. You may have seen a CAT scanner before. It's a round, like a donut, that you lie on a table and go through. And what's in that donut, it may look like it's sitting still, but really inside is an X-ray tube. An X-ray tube goes around the periphery of that, and there's a detector that detects the X-rays opposite the X-ray tube. And it goes around the body rather rapidly, and as it goes around the body, the X-ray detector senses the different amounts of radiation that comes through. Then the computer reconstructs all that data and gives us a view of how the body looks, as if we cut the body in half and had a cross-sectional view. And we can actually cut and dice any way we want, look from any sort of angles. This is a very quick study. It's a very low amount of radiation these days, and allows us to see masses in the body, allows us to see if there's any blood vessels that are abnormal, like an aneurysm, that sort of thing. It allows us to see cancerous lesions in the body. We can also see if the liver's diseased and those sort of things. All sorts of interesting things we can see inside the body.
So how does that then differentiate from what you hear, you know, even in those like medical dramas and whatnot, like an MRI? What's the difference between those two?
Now, MRI is the next advancement beyond CAT scans. It's a newer version of looking at an axial image, or an image, a cross-sectional image rather, of the body. But where CAT scans use X-rays, the MRI scan, which stands for magnetic resonance imaging, uses a magnet. And so it's the same kind of machine. It's around you, but it's a little bit tighter, a little bit closer into you. But there's a very high energy magnet that's in the periphery of this machine. And the magnet turns on and it turns off. And when it does, the small atomic particles in your body shake ever so slightly. But detectors can detect that little shake, and by looking at different kinds of shakes that it detects, it can then reconstruct an image and give us a cross-sectional view of inside the body. These MRI scans take longer to acquire the image, so what happens is if a structure inside the body is moving, like the heart or the lung, we can't see it that well because it gets kind of blurry, because it takes long to reconstruct that image. But something that doesn't move, like a bone or the brain or the spinal cord, we can see much more detailed than we can with a CAT scan.
So I think some people, you know, when they hear about getting these scans or getting a mammogram or something, they think about the radiation exposure. I mean, should patients be concerned about the exposure from these different types of studies?
I think patients should always be concerned about radiation exposure, medicines that doctors give them, surgery that doctors may recommend. You always want to have a healthy concern for these sort of things. But let me reassure you that MRIs and ultrasounds, first of all, they deliver no radiation. There's no radiation involved at all, and there's very minimal risk with either one of those. CAT scans and mammograms were historically used to be involved with a good amount of radiation. These days is very, very little. There's modern CAT scanners that are maintained properly give less than 10% of the radiation that they once gave. Mammograms, the digital mammograms where we do mammography in the breast, give very, very little radiation is used to get those images. You have to balance the negative effects of radiation exposure with the positive information, that's going to be gained to help diagnose a disease or cure a disease. Recently, there's been some talk in the media about CAT scans and mammograms possibly doing more harm than good. But again, you have to weigh the exposure with the benefits of it. And again, let me reassure you that the modern equipment has very, very little radiation.
Okay, so what advice would you give to somebody who might be watching right now that might need a medical scan of some sort? What would you recommend that they talk to their doctors about?
Well, that's a good question. First of all, find out what the study is, why it's being recommended. Again, be your own advocate for your health. Find out what the doctor's looking for. And very important to get the preparation instructions. When you go for the test, sometimes you have to have a full bladder. Sometimes they want you to have an empty bladder. Sometimes they want you to fast before going there. Sometimes they want you to eat a lot. So find out those sort of things, because you would hate to take a day off of work, go get this test, and find out that you weren't ready for it, and you have to reschedule for another day.
Yeah. All right, Dr. Ackerman, thank you so much, as always,
Jason,
for being here. We appreciate you and sponsoring the segment. And Dr. Ackerman is with us every Friday and will be here next week talking about testosterone. So for any questions regarding today's topic or any other health questions that you might have, very simply just visit firstcoastoncology.com. You can confidentially submit your questions to ask the doctor. They can be about this topic or they can be about anything that you have on your mind. They will respond. And again, it's firstcoastoncology.com.